So to begin my administration of medication with my patient, I would knock on the door to begin with, introduce myself, say hello, my name is Andrea Garcia, I'm your student nurse for today. I'm going to administer a couple of medications for you today. Will that be all right? Once they give me their consent, I am doing hand hygiene, enter the room properly, introduce myself. I'm going to ask for 2 identifications, their name and date of birth. Then I'm going to look at my MAR to make sure that I have the right patient, the right medication, the right dosage. Those are my 3 checks. And then I'm also going to do another 3 checks, make sure that I'm within their 7 rights. And when I give their medication, I'm going to be doing 3 checks. When the first check is when I'm dispensing the medication, making sure I have the right one. Then when I'm measuring, I'm going to be assuring that I have the right dosage. And then when I'm at their bedside, I'm going to make sure, once again, it's the right patient with the right medication and the right dosage. So to begin, I would make sure that if it is a pill or a liquid, with a liquid, I'm going to give it to them. If it has a bitter taste and they can't handle it, I'd give it to them in an applesauce, of putting any type of food that they don't favor, so that I don't necessarily ruin the food for them. And if it is a pill, I'd give them their little cup of water and their little cup with their medication in there. I stay at their bedside until they have taken the medication. I may not leave. And once everything is discarded of, once the little casings of the medication have been used and everything, then I discarded it properly. If it is not used, I need to take it back, and if it is remain closed, I can take it back to where it came from, where all the medications are. And if it was opened, I would have to record it and explain what it is that happened if the patient decided to refrain from taking that specific medication. For a buccal medication administration, I would put it right here within the cheek and where the molars meet, and it should dissolve. No water is necessary for this. The medication will dissolve on its own. They just need to keep their mouth closed, not chew on it or not bite it, anything like that. As for a sublingual medication, it would go right here in this pocket under the tongue and to the cheek, and it will also dissolve. No water is needed, and like I said, it should dissolve on its own without chewing or breaking down. For a ophthalmic medication, there are ointments and there are drops. For a drop, you would want to put it within conjunctival sac, and you would place it along here. And to expose that sac, you would grab the cheek, pull it down the eyelid a little bit with a tissue or a cotton ball, and then you would place it there. And if it is an ointment, you would go from the inside to the outside, again making sure that the area is clean, there are no debris, no type of buildup within the eyes, and then you would apply the medication from the inside to the outside, once again exposing that sac. For an otic administration, you would get the medication and place it here. However, you are not to touch the patient's ear. You are only to place it above. Make sure that their head is a little back and to the side. Drop that in. Make sure that they stay within that same position for 2 to 5 minutes so that the medication can go in. And then for the nasal, it depends on the area you are focusing in. So if it is an ethmoid or a sphenoid administration, you would just tilt their head back and place in the drops, again not making contact with the patient's nose. And then if it is a maxillary or a frontal sinus area that you need to displace the medication in, you would have them tilt their head off of the bed, hold it with your hand, make sure that once again that area is exposed, and drop it. And this medication should stay supine for 5 minutes, making sure that the medication has its access to travel back. Throughout all this, I should have my stethoscope just in case, to make sure that if any medication alters a specific type of vital sign or any other thing, that I can assess it before I administer my medication, as well as for any type of instance. I will check for adverse reactions within my patient. I will come back and check after, making sure that they're okay. And before every administration, I need to explain what medication it is I'm giving to them, why it is I'm giving it to them, which belongs to their rights. Then also for the ear and eye, like I said, I need to make sure that there's no drainage, no secretions. I need to clean those areas properly before I can administer that medication. Once I am done, I will lift up the rails, lower the bed, and after lowering the bed, I give them the call button, make sure it's within their reach. Then I would take off my gloves, perform hand hygiene again, make sure that I recorded everything properly, ask them if they have any more questions, and then I can leave the room.